My name is Melissa Kellenberger, and I will be doing my speech today on Mrsa. I've included my outline on my iPad, so I'll be using that. Did you know that we have a group of bacteria that live on our skin and in our nose? Most of the time it's harmless and we don't even know that it's there. Not only can people carry this group of bacteria, but it also is found in our food and in our animals, according to EFSA. It's transferred quite easily from person-to-person contact by an open wound or cut. Most people have a strong enough immune system that they can fight off this bacterial infection and only experience mild symptoms. Although people with a weaker immune system, such as the elderly or infants, may experience more symptoms and or death, according to the EFSA. Mrsa, it's called Mrsa, methicillin-resistant Staphylococcus aureus. Mrsa is resistant to all current available B-lactam antibiotics, such as penicillin and many more. It causes a range of infections from mild to life-threatening bloodstream infections to pneumonia and more. Hospitals have had issues for many years, mostly in surgical wards and intensive care units by open wounds. An open wound may be a wound from a IV catheter placement, poor hygiene, from a nurse not washing their hands properly or not wearing gloves that's treating a patient with Mrsa and then contracting it to another patient that they have treated. Sterilized equipment in a hospital setting is an issue. We also see Mrsa in wrestlers with skin-to-skin contact. Mrsa is a well-known foodborne pathogen that produces heat-stable toxins during the growth and variety of our foods. Maybe that dish that's been sitting out a couple hours at a picnic. Common ones include meat, poultry, eggs, cream-filled pastries, vegetables. Vegetables is another carrier. It's the least common carrier, but we do see it in vegetables. In 2003 and 2005, a restaurant had an outbreak of Mrsa on the vegetables, green peppers, carrots, and leeks. And the study of the University of Iowa College of Public Health was done. A total of 395 pork samples were taken and a variety of meat samples from 36 stores in the New Jersey, Minnesota, and Iowa area. 26 of those pork samples contained Mrsa. The results are doubling in our food and our animals. And according to IATPS David Wallinda, pigs and pork are 4 times more likely to be carrying Mrsa than our average American. IAHP has been working a decade to eliminate overuse of antibiotics in animal feed and prevent Mrsa on farms in our food supply. If pigs and cows are being found carrying Mrsa, what about our 4-legged canine friends? Can they carry Mrsa? Yes, they can, and we can contract it from them. So with finding Mrsa in our food, animals, and our pets, where do we come in? Well, when we eat contaminated food with Mrsa, our bodies experience nausea and vomiting within probably 1 to 6 hours. We call this food poisoning. When the intestinal flora is depleted or absent, a Mrsa cell may grow, and this causes us to have diarrhea. Studies show that many people who are food handlers, veterinarians, and healthcare workers are found carrying Mrsa in their nose and on their skin, about 50%, and about 20% in their intestines. Also, get this, 1 to 5% of people with indirect animal exposure, according to the PLOS one peer-reviewed journal, are also carrying Mrsa. And this 1 to 5% might be people in the home that live with the people that are working on the farms or the veterinarians. So you don't necessarily have to have direct exposure to the livestock. According to the PLOS one peer review, airborne emissions of Mrsa from livestock farms have been reported as well. Mrsa has spread worldwide and commonly referred to as antibiotic-resistant bacteria in hospitals with different strains, and it's food, animal, air, dust, and it's all around us. So now that we know all about Mrsa and that it's contracted by an open wound, what it does to our pets, our food, our water, our dust, everything, what can we do to prevent it and protect people from getting Mrsa? Well, we can improve our personal hygiene in our healthcare facilities, food handlers, decontamination of all of our equipment, surfaces, and clothing, sterilize stuff, change clothes, judicious use of antibiotics, proper cooking and storage of food, better screening programs. Introducing these techniques may give us a good start to help control MRSA and stop people from getting sick and eating contaminated food. So the best thing we can do is wash our hands. This is my speech on MRSA today. I hope you enjoyed it, and I hope you learned something from it. Thank you.